everybody, this is Rachel Hansen. I'm the Public Information Officer here at Cascade Medical. It's April 16th and here is our week in review. So far we've sent 82 tests for COVID-19 with 76 negative, 2 positive, and 4 pending. We're still seeing a steady number of respiratory patients, same as last week, and we've set up a separate treatment area that is it's separate from everyday medical care, just as a safety precaution. Last week, we were running low on our supply of testing kits, so we had to be strict about testing requirements. But this week, we got some good news. Thanks to Chelan-Douglas Public Health, we now have more testing kits so we can test more people who have symptoms associated with COVID-19, and that is sore throat, dry cough, difficulty breathing. So we now have 2 kinds of tests, one for more serious patients and one for patients who have symptoms but don't need to be admitted into the hospital. So for the long term, we're continuing to search for more testing kits. Increasing our testing capacity is high priority for us right now. So stay tuned, we're working on it. The other thing I wanted to share with you is a trend that we're noticing in our emergency department. We're starting to see more serious cases that are not related to COVID-19. And we're concerned that people who have chronic health conditions or dangerous symptoms like chest pain or sudden dizziness, they're letting that go too long without medical help. So I just wanted to remind you that we are here for you, and we are taking every precaution to ensure that this is a safe and clean place to get medical care, whether or not it's related to COVID-19. Our lab is still open. We're getting great reviews from our telehealth program. And if you are struggling with depression or anxiety or even family dynamics issues, we have a clinical psychologist on staff who can do a lot of good over video chat. So I just wanted to offer you that as a lifeline. We have a financial aid program as well as some help with enrolling in an insurance plan. So we are here for you. In other news, there is a county-wide shortage of washable gowns, so anyone with a sewing machine, if you want a pattern, please visit cascademedical.org and click on the COVID-19 button. In closing, I wanted to share with you a picture of financials. I know that many of you have heard in the news that this is a tough time for hospitals right now. Expenses have increased while at the same time a lot of our services had to be postponed. So at Cascade Medical, we've crunched some numbers and we anticipate that there will be a $1 million shortfall in revenue between mid-March and May 1st. We did receive a $400,000 grant from the Federal CARES Act last week, which will help, as well as a forgivable loan to help keep our staff whole through the end of June. And then for the long-term sustainability, we're working on funding opportunities and plans to reopen services when it's safe to do so. So in closing, I wanted to thank you all for staying home. Thank you for your support, and we'll see you next week.